Edwin Mutura and Charity Muturi, both of who have participated in our programs, but who also have a wealth of experience beyond our programs in as lived experience participants in many programs. So our presentation will focus on participatory research with people with lived experience in mental health study. And as you've heard, those are the presenters. So I'll start by discussing what we are going to be presenting about. So myself, I'll take the introduction. I'll go over what we're referring to when we talk about lived experience, the value of having people with lived experience in research, as well as the law, policy and law frameworks that underlie their involvement. Then Edwin will take us through the strategies to promote inclusion. He'll cover the obstacles to inclusion, how to promote meaningful and authentic engagement, as well as the principles of engagement. And Charity will cover the building collaborative partnerships. So she'll talk about the role of experts by experience, the gaps and opportunity, as well as lived experience financing and capacity building. And we'll have a slide that has links to various papers that we'll have referenced, and we'll also, and there are various documents that we'll talk about in our slides that you'll feel free to access at your own time. So I'll go into now my slides have stuck. Okay, so I'll talk about what we mean when we talk about lived experience expertise. So in various documents have defined it in different ways, but basically it's that unique in-depth knowledge and insight that one gains through their own experience. So it's not something taught, it's not something covered, it's not like a psychiatrist's knowledge of the problem from what they've studied in school. Rather, it's what somebody learns through their lived day-to-day experience with their mental health condition. And we recognize that there's diversity in each person's individual recovery journey. And each person knows better than anyone else how it affects their life, what they go through to get a diagnosis, what they go through to get treatment, how the treatment affects them, how the symptoms or side effects impact their daily life, and what it's like to interact with the healthcare system. So that wealth of experience is what we talk about when we say lived experience. So it's based on one's perspective. So it's unique in that my perspective of living with anxiety would differ from somebody else's perspective. It's different based on personal identity. So how a woman experiences the system, it would likely differ from how a man experiences it. How a youth experiences it maybe would be different from an older person. Same thing, with it a refugee, their experience would be different. So with the current capturing all these different perspectives and the perspectives of people of different personal identities, whether it's sexual, gender, age, all the kinds of different identities, their experience would be likely different and unique. And also the history. I mean, if I have access to care, my experience will be different from somebody who doesn't have access to care. If my access to care is through public services, my experience may be different from somebody's whose access to care is through private. So all that, these are different perspectives that people with lived experience bring on board. So they contribute, we contribute in ways that no other expert in the field can offer, because it's my unique perspective, what I am going through. It's different. I could explain to you how to walk in my shoes, but you cannot say you truly understand it unless you hear it from myself. So then I'd like to mention that it includes an experience of different mental health conditions, and different people interact differently with their mental health conditions, the strategies that have been put in place to address these conditions affect people differently. And sometimes we hear people use the term lived experience when they're also talking to caregivers or the family members. And we respect that, because living with somebody with a mental health condition, you too have your own experience to share. So it may not be the experience of living with the condition, but it can be an experience of caring for somebody. So they also know how they interact with the system, what they observe, and their view is also very well valid. So there are different terms used to describe the people with lived experience. Some use the terms lived expertise, living experience, patient expert. So what we would request you researchers, maybe not service users. At times we hear the term service users used, but that limits the experience of somebody to only the interaction with a service provider. But the interactions are various, and at times even the person themselves who has a lived experience can be a service provider, like maybe Edwin will take time to explain about his ADHD coaching. So maybe not to use the term service user, unless of course when referring to services. So I'll move on to talk briefly about the lived experience value. And one thing that engaging people with lived experience helps us to do is to move from this one-size-fits-all interventions. When you have a diversity of views, you talk to people who have experienced the private system, you talk to somebody who's experienced the public system, somebody who's experienced maybe the care from other non-conventional care. It can help us inform the development of either policy or practices that really reflect the choice and the will of somebody who themselves has a condition. So it's important to listen to their voice, because we have in-depth experience of the social and human rights impacts of living with a mental health condition. It's about that hardship, and I have experienced the hardship of being ostracized, marginalized, discriminated against while struggling to navigate that mental health system to seek services. The kind of perspective I bring can really shape what kind of services can truly promote my recovery. It would be excellent if research really takes that on board and informing policy and practice. So we say it's important because they provide an understanding of what is needed also to remove the barriers to inclusion. When I talk about high experience stigma, then it makes it easier for people who, for example, in our campaigns, when we talk on media, and we basically, I don't want to be portrayed as a victim all the time, or I want my story of recovery told, not only my symptoms, and to be seen more as a person. We have people who say I'm a mother, I'm a wife. So don't just portray me as somebody, a depressed person. That's not my identity. So when we listen to these voices, then we know the kind of narratives to tell, how to speak about it, and I'm sure the language of inclusion will be spoken more by my colleagues, Edwin and Charity. So the next thing having a voice of lived experience can do is also to catalyze political action. When you have all these people and they are given an opportunity to give their voice, we know how politics works. It's about numbers, it's about people's true experience that shapes these things, that moves of politicians to act, that moves people to legislate, that moves people to change how things have always been done. When they see the people, what they're doing, I mean, these actions, the people they are affecting, maybe it could lead to a better improvement and across sectors, so that we're not only limiting our conversations around mental health to the health sector. I mean, it's about how I experience my education. If I'm a child with ADHD in a public school, how am I experiencing education when I cannot concentrate on something for so long and I'm being beaten for moving about? If I have a panic, anxiety disorder, and I'm having a panic attack when a teacher points at me and asks me a question, am I being beaten for not responding? Am I being told I'm disrespectful? So it's across sectors where we can truly change the practice that accommodates people with mental health conditions. And I'd like to say it's important to also capture the perspectives of people in different geographical, cultural, political, economic, social contexts. They all affect the condition differently, and different, all these different spaces have things that they can do to contribute to a better experience for somebody with a mental health condition, and we can push for more accountability and governance nationally and regionally. And of course, people with lived experience are uniquely positioned to provide suggestions for cost-effective and practical solutions to enhance mental health system and even the referral systems.